Hello and welcome to Tai Chi for Therapists podcast, where we explore the evidence and practice of Tai Chi and qigong in clinical settings. Welcome to Episode 3. I'm Helen Parsons.
And I'm Philip Sheridan. And on today's show, we have Carole Edin, an occupational therapist based in Leeds. Welcome, Carole. Thank you for joining us.
Thank you for having me.
Hi, Carole. You're a pain specialist occupational therapist. Can you tell us a bit more about yourself and that role, please?
Yeah, well, it's a very interesting role, actually. And I always say when I have students with me, I always say it's a really interesting role to go into because there's no 2 days are the same, really. I actually went into that role because I've had experience of chronic pain myself. So I'm very interested in it on a personal level as well, and in pain management. And I'm really quite passionate about it now. I've got really passionate about the whole thing of self-managing pain and how we can be kinder to ourselves and pace ourselves and things like that. So, yeah.
And how long have you been in the role?
I've been in this current role for 6 years, but I was working in pain management before that. And then I worked in mental health and then came back to pain management. As my old manager said, I was another tour of duty.
Wow, you're definitely a veteran. Can you tell us a bit more about the service, about who comes to your service? How did they get there? What would your typical patient kind of be like? A little bit.
Well, we see people from the age of 18 upwards, which some people are shocked. They think chronic pain, it might be someone older, but it's from 18 upwards. And there is a children's service for chronic pain as well. And sometimes we get people who have been through the children's service and then come to us. And they have a very wide amount of conditions, really, and other comorbidities as well, such as anxiety, stress, PTSD, heart conditions, diabetes. The list goes on, really. And anyone who's really referred to us, they have had chronic pain for at least 3 to 6 months. But a lot of people have had it for years. They've been trying to manage it for years before they get referred to us. And the conditions can range from chronic migraines, pelvic pain, chronic low back pain, all sorts of different conditions, really. We see people who have hypermobility, Ehlers-Danlos, and, lots of different conditions, really.
Wow. So yeah, a really broad specialism, as it were, if you can have a broad specialism, but it feels like you've got to know an awful lot to cover this. Can you tell us a bit more about the strategies that you tend to use in pain management?
So really, the main thing is the first thing I tell people, or advise people, should I say, is to try and be kind to themselves, which it might sound strange, but that's the top, for me, that's the top thing is they need to sort of start to learn to be kind to themselves. And that takes practice because none of us are really that kind to ourselves. So the first thing is being kind to ourselves, and pacing activities. So that we're not getting into what we call the boom and bust. So if we have a better day and we try and do too much in that better day, and then we have to rest because of that. So it kind of leads into that cycle, really, of overactivity and then rest and then feeling a little bit better and doing a lot. So we try and sort of advise people to do things little and often with lots of pacing breaks. I call them micro breaks. So we're doing little bits, then having a break, and also alternating what we're doing. So you might alternate the activity. So if you're doing something physical, and then you might have a little bit of a break and then do something that's more taxing mentally, like it might be you have some phone calls or some bills to pay or some paperwork, and it all takes our energy. So I usually advise people to just alternate the activities like that as well.
Oh, right. Really interesting stuff. So we've kind of got the idea of some self-compassion and kindness and pacing our activities and having variety. And do you talk to people about sleep and a bit about maybe eating as well? Some of those other
Yeah. Well, we do in our groups. We have a whole week on sleep hygiene because obviously sleep is quite a big thing, really. With pain, a lot of people are not sleeping well. If we're not sleeping well, the research shows that we actually feel more pain the next day and find it hard to manage next day. And again, diet and nutrition as well. We have a parts in our group talking about diet and nutrition and vitamins. Low vitamin D. I see lots of people who in their notes are low on vitamin D. So we talk a lot about the importance of having enough vitamin D.
So lots of different aspects. It's a real whole person approach. Would you say that in pain management?
Definitely, because we also look at emotional, as you mentioned, emotional well-being, and our thoughts, how our thoughts can impact on, stress impacts on pain, the stress system. Nothing we're doing wrong. It's just the way the body works, and stress can impact on pain. So we look at some stress management and some coping strategies and things like that. So lots of relaxation. In fact, one of the first things after the being kind to yourself, I talk about is relaxation, to trying to get some strategies in to relax. And it can be difficult for people who've got chronic pain. Lots of people say, I'm not very good at relaxing. Oh, I can't relax. I'm always tense. And obviously being tense, that we do some tension spotting with people and some breathing exercises, but it's not one size fits all because some people just might not get on with some of the relaxation. So it's trying to find ways for each person, each individual, that they can relax, really.
Brilliant. So we're going to sort of talk about how did you end up using Tai Chi? So Tai Chi gets described in lots of different ways, as a moving meditation or as a gentle relaxation, or and lots of different explanations. How did you come across Tai Chi and ended up using it with your patients?
Well, in my opinion, it's the ideal thing to use with patients with pain, because when we talk about movement with our patients, we talk about enjoyable movement. We don't usually mention exercise because that can strike fear into somebody who's got chronic pain. But exercise, so it can be that fear avoidance of movement. So I think Tai Chi is so gentle and so relaxing. It can help with the relaxation part of it as well. So it's really, in my opinion, the ideal movement. It's mindful movement, isn't it? Really. So we're looking at mindful movement, but we're also looking at the breath as well with it. So I think lots of people get on with it because it's so gentle. I usually explain to people, when you're doing it, do it in slow motion. And for anybody who's old enough to remember the $6 million man, when he was going in slow motion, I always say that to people. So, you're doing it so, because sometimes people will start off and go really fast and jerky movements. No, you're like a ballet dancer. You do it slowly.
Those are lovely cues that you're using there, Carole. How do patients respond to the idea of Tai Chi, or how do you frame it for patients?
Yeah, well, most people respond quite well to it, actually. Most patients that I speak to really respond well. It can take a while for some people just to get the hang of it, but I show them a little bit of, in the clinic, I show them some basics, just some really basic movement. And again, really talking about pacing and not doing too much at once, because with anything, any new thing that someone's trying, if they try and do too much at once, it can flare up the pain. So then if the pain flares up, it can put them off and then say, I'm not doing that anymore because it's flared my pain up. So I'm really careful to advise them to just do a couple of movements to start off with and gradually just grade up very, very slowly with things. Maybe do it regularly every other day or every day if they can, just a little bit. then after about 2 weeks, they can introduce another movement. So it's a really slow process to avoid them sort of flaring up the pain, which can happen sometimes if you do too much at once. So that goes down quite well because they're finding that they can do some movement. Start it off seated. So I always say, start it off with the seated movement. You can progress to standing, but give yourself time to progress to standing. We're not in a race with anyone else. We're just doing it for ourselves, and so give themselves time to just to get used to it. So that usually goes down quite well because they're not flaring up the pain with it.
So it sounds like you're very sensitive to meeting your patients where they are and giving them permission to kind of participate at a level that suits them. And it's very individualized as well.
Oh, definitely. For each person, it really is. Well, I did have someone who, before they had chronic pain, they used to do martial arts. And they said, oh, I really miss. And I thought perfect thing for him was, right, Tai Chi, and I said, look, it's based on, and he really enjoyed it. So you just meet everyone where they are really, because of each individual. Then someone else might not have done any movement for a very long time. So again, you're starting off really slowly with them.
Wonderful, thank you.
Yeah, can you tell us a bit more about that fear avoidance or people coming in with tension? Because I know we've chatted before today's meeting, and yeah, you were saying you can kind of spot people coming in when and what that looks like. Can you tell us a bit more about that?
Yeah, so as you can understandably, if someone has got so maybe an example of chronic back pain, chronic low back pain. And if they have to bend for something, they will have that fear avoidance. So before they even make that movement, that in their brains already, this is going to hurt. So you've got that thinking. I always say to people that our thoughts are like viruses. We used to have a poster on one of the clinic walls where I worked before, and it mentioned the thoughts being like viruses and they can spiral out of control. So if you think about a movement, so you might drop something on the floor and you've got chronic back pain, immediately you'll think, I can't bend for that. So you're already got those thoughts going round that are spreading like the virus. And you would say that my back pain will flare up. I'll go into a spasm. So I see lots of people whose back goes into spasms for, and then they're sort of laid up in bed for a while. They can't move after that. So understandably, you've got people who've got that real fear avoidance with movement. So introducing something really gentle and slow and relaxing can really help with that fear avoidance.
It's quite amazing because I don't, strictly speaking, live with chronic pain, but I do continue to have episodes of acute pain as a consequence of my accident, even over 20 years ago. And it's really interesting how when I am having an episode, and Helen will vouch for this, is that it actually changes how I move. It actually changes how I actually inhabit my body and feel about myself. Is that something that you hear from patients as well, Carole?
Oh yes, all the time, all the time. People and as you say, people can be very sort of stiff as they're walking in and very tense, and it's trying to gradually get rid of that tension. Their shoulders are tense, or you can see it in their face. Everything is tense, and obviously then we're tapping into that stress system and that fight or flight with you tense like this. So it's trying to just settle that down a little bit, really, with some relaxation and things like that. And just really to let the brain see over time that part of the brain that's telling us that, there's something wrong, to let it see that actually we can do some movement and we're not going to flare up the pain. So that's the main thing. is just letting people see that, yes, you can do some movement and slowly introduce more movements over time that won't flare up the pain. And then once that happens, people are more likely to want to do a little bit more as well. But it is very difficult, as you understandably, it's difficult for people. If that's why I don't use the word exercise. It was a colleague and I who we used to do some groups with people, and we used to do quite a lot of movement in the groups. And we said, we're going to say it's enjoyable movement. We're not going to say exercise. It's enjoyable, and emphasising the enjoyable bit. And also maybe having a little bit of a laugh as well. You're sort of laughing with people and joking with them, and that can go down quite well, because obviously if you have a laugh, that relaxes you as well, doesn't it? Laughing and things, it's the endorphins and things. If we have a laugh, things like that, so that can help as well. So we try and make it fun as well.
I think you've got some amazing points in so quickly, Carole. We've already talked about, self-compassion, that kindness, the importance of relaxation to kind of dampen down that flight and fight response, the importance of, quality sleep and how that impacts pain, and introducing Tai Chi in a way that makes it relaxing as well, that makes it fun, that takes it away from exercise to being something that's about taking care of ourselves. And all these things are so important about when we are introducing it. Setting the scene is so important, isn't it? Is there anything else that you do when you're introducing movements, these enjoyable movements, or to help people?
Well, initially, when I start off with people, I do a little bit of relaxation and tension spotting with them. Mm-hmm. So to start off with, so they're more relaxed when they start. So we look at some gentle, looking at relaxing the forehead, relaxing the jaw, the shoulders, the hands, and the breathing. So we do a little bit of that before we even start. So we're starting off nice and relaxed. We wouldn't just go into it, and then do a little bit of relaxation at the end as well, so people feel very relaxed.
Fantastic.
You mentioned the breathing there, Carole. Do you use a particular kind of exercise, or is it just a kind of focus on just kind of quiet breathing?
I think it depends. Again, it's very individual, because I might see some people who have COPD, for example, and if I start saying to them, "Oh, we're going to do some diaphragmatic breathing," and you're going to imagine that you're blowing a balloon up in your tummy, it'll be really difficult for them. So for someone with COPD, I would just relax the breathing and get them to relax the body and everything, and not focus on any deep breathing or diaphragmatic breathing. As someone who, or I might do with someone else, I might do some diaphragmatic breathing. And sometimes we just say, imagine that you're blowing a balloon up in your tummy gently, and then you're letting it out slowly. And again, one lady said, I felt a bit when and I said, just make it a smaller balloon when you're blowing it up. So that was a good way you don't have to blow up the balloon till it's nearly bursting, just a smaller, and just relaxing that breathing. And that just usually relaxes the whole body system as well for people.
Fab. I like the fact that you're very clinically appropriate. You're aware that for some certain health conditions, you mentioned COPD, I guess asthma would be another one of those issues where sometimes in Tai Chi, there's a big focus on breathing, but it isn't always necessarily appropriate for certain clinical populations. And again, that's where it's important to have that nuance, isn't it? And that you're not just using a rote type exercise. You've got a clear rationale there, haven't you, for why you might use something and might not use it.
Yes, definitely. And it's very sort of basic. The movements that I do are very, very basic movements, but people do enjoy them as well, because they do feel relaxed afterwards. Most people say they feel quite relaxed afterwards as well, which is the main thing we want, really, is for people to enjoy doing some movement and feel relaxed as well. And so that they want to do it more. So they want to, when they go home, or when the group's finished, or that they actually want to do more of that movement and practice it regularly as well. So I do emphasise that practicing it regularly is important as well. I think some of the research that I've put through is it does mention that the longer duration of doing the Tai Chi is better for rather than just doing it for a short duration as well.
Absolutely. So it sounds like you do a lot of work to get buy-in, and then you're kind of reinforcing that adherence, really. You're hoping that people will remain engaged with the service and also continue their practice of Tai Chi and all the other strategies that you are helping them with at home as well.
Yeah, because most people we see do, sometimes when they mention their goals, because obviously we set goals with them, and a lot of them do want to improve the function, they want to improve the mobility, and they want to improve function. And it's, I think Tai Chi is a great way to do that. It's a great way to improve the function.
Fab.
Brilliant. So you've described a little bit about introducing it one-to-one. I believe you also do it in groups. And is that how you first came across it? There was already some Tai Chi being done by a physiotherapist. Is that kind of how you first?
The first time when I worked in another team, yes, when I worked over in Huddersfield, yes, that was when we did it in the group. Because our groups were a lot longer over in Huddersfield. We did quite a long group, and we had quite a lot of movement in those groups. We had the sort of a good enough time really to do that. So we did relaxation at the end as well. So we did a lot around relaxation, and in every group, every week, we would do some what we called enjoyable movement with people, and that's when we first started to introduce it. Yeah.
Fantastic. And did you find any difficulties? Because obviously one-to-one you can kind of really tailor it, and when you've got a group, we often get asked this question: how do you kind of cope with a group situation where everybody, like say, won't be the same? You may have people there for a variety of different reasons, even though it's all chronic pain. How do you find introducing it to a group? And how do you tailor it?
Well, I think for tailoring for a group really is, again, just to mention to people that we're not in a competition with anybody else, that we will just do. So if sometimes I will mention, if you can't raise your arms for any further than that, that's fine. Just raise them, just adapt it. So I always say it's adapted already. The one that we were doing is already been adapted for people with pain, but you can adapt it even further. And even going so far as talking about imagining doing a movement.
Mm-hmm.
So, and I got that from years ago when there used to be a drop-in with a colleague of mine used to do a drop-in in Headingley. I think it was a monthly one for people with chronic pain. And a lady used to come and do some seated yoga. And I got that from her. She said, if you can't do the movement, just close your eyes and imagine doing it. And you can be a bit skeptical about that, but actually there is some research to show that if you imagine doing a movement, and I think sports personalities do that, imagine doing something, actually it can have an impact on that actual muscle. So you can just, and we used to sort of explain that and say, just imagine, if you can't, you don't feel like doing that particular movement, just close your eyes and imagine doing it. And that seemed to go quite well once we'd sort of explained why we're telling them to do that. And it's not because it can sound a bit strange when we talk about something like visualization but once they've done it, they kind of enjoyed doing that as well and felt like they had done a particular movement so I've sort of crossed that over into the Tai Chi as well, and sort of mentioned to people, just imagine, close your eyes, relax, and imagine that you're doing that movement.
Wonderful, wonderful. I think it's been helpful to have, we've just had the Olympics on, haven't we? And I think we sometimes see that little shot to an athlete that's sat by the side of the track or by the side of the in the gymnasium, and you can see them in quiet concentration, can't we? And often they'll be doing their routine, mentally, won't we? So that's helpful, I think, sometimes to know that that it is used in sports, this mental imagery, and visualization is our tools that we can utilize here. I wonder if you can tell us about any particular patients or conditions that have responded, maybe conditions that you find do really respond to Tai Chi, or maybe an individual patient that's a case study, obviously anonymous, that you can tell us about that's responded.
Yeah, well, I had not that long ago, actually, and I have been working with this young man for quite a long time, really, and he's 37, and he's got fibromyalgia, and he's also got ADHD. He has anxiety, and he's got autism. And he's got the ADHD, and so he was finding it really difficult to get any relaxation. Really, it was really difficult because of the ADHD, and so I mentioned the Tai Chi to him, and he was a bit skeptical at first. Actually, he's like, "Oh, I'll give it a go." And so he did. He started doing it, and he's very good. He's always wanting to do all, because he wants to improve his function and he wants to be able to do more. And the last time I spoke to him, it was really fantastic, actually, because he said that Tai Chi had been the one thing that's keeping him going and making him feel better. And he's really ran with it. Really, he's doing it really regularly. He's finding it relaxing, and it's really helping him. And he's able to do it, and he's relaxing at the same time, but he's doing some enjoyable movement. And he's able to do that, and which he didn't think he would be with the ADHD. But so it's helped him. So that's sort of, when we're talking about conditions, he's got the fibromyalgia, the ADHD and autism. He has anxiety, which obviously, can go hand in hand with having to manage those conditions, really difficult. And so he's found it fantastic. And he did say it was the one thing. So fantastic, really, really good.
That's tremendous. And again, it sounds like, that person has moved into a certain degree of self-management now.
Yeah, and it was really hard for him before. I mean, and he was trying lots of things. He was trying, he was pacing. He was trying the relaxation. He was doing all the sleep hygiene strategies. Trying to change his diet. Everything really. That we would trying to be practicing the self-compassion, telling himself well done regularly. Lots of things, and. But the Tai Chi, he said, has been the one thing that's helping him it's helped everything to come together. We talk a bit about, in our groups, talk about it, pain self-management being like a jigsaw. So it's like a jigsaw puzzle of lots of different things. And one thing on its own won't help. It's doing all the things together, really, putting that jigsaw. And I think it's helped him to fit all those pieces of the jigsaw together, really.
That's a great analogy. I like the jigsaw analogy. It's one I've used personally in response to trauma as well, and a sense of slowly but surely finding those pieces that create a coherent picture for yourself and something that's meaningful as well.
Yeah, and everyone's different, aren't they? We once had a lady in one of our groups who... she said it was like when she'd finished the groups, and I always say once you finish the groups, it's like, when you pass your driving test, that's when you actually learn to drive. So I said, you're all learning to drive now, that's when you learn to drive once you've passed. And this lady said, I feel like I've put together my own recipe book, and she's got all her own recipes to manage the pain, and everyone's obviously different and taken more of one thing than another. And she'd put together this, and I thought that was good as well. She's got this recipe, a recipe book of pain management strategies and self-management.
Yeah, again, a brilliant analogy for, like, say, putting something together that's really personalized. Pain is always a very personal experience, isn't it? And we have to have that personalized response. And Tai Chi may be a good fit for some people and not for others. Did the person in question, the young man in question, did he get to improve his function? Did he get to reduce his medication? Sort of what was the outcomes of him being able to incorporate Tai Chi more regularly?
Yes, I mean, he's been wanting to reduce meds for a long time because he doesn't like being on meds at all. He's really been wanting to reduce meds, and he has been able to do that, which is fantastic, really. And I think it's sort of unbelievable to see those. It's been a slow process, but he's done it, and he's got there, and he has managed to reduce his medication as well.
That's a fantastic, tangible outcome as well.
Brilliant. So it sounds, there's been loads of benefits. Have there been any challenges to incorporating Tai Chi for you personally or within the service? How is it getting going with Tai Chi?
Well, initially for me, because my coordination's not that great, I thought, well, who's going to watch me doing Tai Chi, and I usually, my confidence wasn't that good at being able to show other people how to do Tai Chi, because I've just got no coordination at all. So, but I always make a little bit of a joke out of it, and talk to people and say, look, you're all going to be much better than me when you finish because I've not got any coordination. But I think it has actually improved my coordination just doing it regularly with people and doing my own little practice. So I think it has actually improved my coordination as well. So that's a bonus.
Fantastic. And that's something we like to talk to when people come on our course. I like to say, this is something for you as well. Do you think there's been any other health benefits for you from doing your little bit of practice, learning it and incorporating it into your day?
Definitely. I mean, I do it as when I go into clinic. As soon as I get into clinic, I go into clinic quite early because I set the computer up and get the notes up and have a look. And so it's before my sort of start time. So I do a little bit of Tai Chi. Actually, I do a little bit of relaxation. So I do the relaxation, some breathing, and I do a little bit of Tai Chi, and that kind of sets me up for the day.
Brilliant. I love that. It's a great way to start the day, isn't it? You really are modeling what you'd suggest maybe to your patients as well, sort of how to start your day, to start off gently, have some compassion and yourself and starting very gently with some movement. What would you say? I believe you are going to do a little bit more in-house training. Is that right? So you're looking into fibromyalgia and the research around that. That's a specific area of interest for you. Can you tell me a bit more about that?
Yeah. So, I've been putting together some slides, some PowerPoint slides, just to do some training for the rest of the team on fibromyalgia, and looking at the research. So I've looked at the research on actual Tai Chi and fibromyalgia as well, and the benefits. And it is, the research shows that it is very beneficial for fibromyalgia. So it was quite interesting for me to look at these slides and to see, that it actually does benefit fibromyalgia.
Brilliant. So do you think more staff members will be taking up a bit of Tai Chi themselves and incorporating it into their work with patients?
I hope so. I mean, a lot of my colleagues do. One of my colleagues very interested in it. She does mindful movement with the patient. So, and obviously most of my colleagues do some sort of movement with patients, and all of them introduce it steadily and slowly like I do, but I really would think that it'd be very beneficial for everybody to be getting involved with some Tai Chi.
Brilliant. So it's just one more tool in the toolbox. Like you say, you can have lots of different movement forms that maybe some yoga, maybe some Tai Chi, maybe something that you call mindful movement. But having a selection really helps you to personalize it. It sounds like for when you're sitting with a new patient. Any other maybe any advice that you give to somebody thinking of working in pain management or thinking about using this sort of movement, Tai Chi or qigong? What would you say to them?
Well, I think I'm always encouraging, as I say, when I have students with me, I always encourage them to look at working in pain management, because I'm the only occupational therapist in our team. So I'm the sole Lone Ranger occupational therapist in our team, you know. But it sits very well with occupational therapy, does pain management. It really does. And it's never boring because you never see, everyone's so different that we see. And you've always come across a patient that you think, oh gosh, I've not come across that chronic pain condition before. There's always something that you have to look at and research. And I do like researching things. And yeah, it's really interesting, but I'm very passionate really about helping people to self-manage and be kind to themselves. And so that my passion really is to show people, you know, that there is a way that we can manage the pain and get on with our lives. The pain's not, you know, we never promise that the pain's going to go away. We can't promise that, but we can promise them that actually their lives can get bigger around that pain. You know, it's like looking at your life will get bigger. We'll look at fun goals, so doing fun things, because the first thing that goes out of the window when people develop chronic pain is fun. So I can't have any fun. I can't do that hobby anymore because it's taking me all my strength and energy to get a shower and get dressed. So I can't. So it's trying to introduce that fun slowly as well, so making your life bigger around the pain, really. And it's very rewarding. I would say to people that it's really rewarding. So I would actually always say to people, just go for it, and definitely with the Tai Chi, just try it, go for it with people.
Fab stuff. I love that image of making your life bigger around the pain. It's such an important idea, because again, your life slowly shrinks, doesn't it, as chronic pain takes its hold, and it's helping to people to begin to expand out of that bubble.
Yeah, and once they notice that you know, their lives are improving and things, it just expands, like you say then. And so the pain, that circle, that pain is the same size, but your life's just bigger than that circle of pain. And the distraction, you know, that distractions are really good. So getting back into hobbies and things is really important, and seeing people. A lot of people with pain don't particularly maybe want to meet up with people because they don't know how they're going to be on that day. So actually, I usually say to people, try and just coordinate a good time that's for you, and just mention to people that, you know, maybe an evening's not very good, but you can meet them at lunchtime, and you know, and then you can still see people and have that, you know, socializing with people, which is really important as well.
Wonderful. A really lovely, positive way to end this podcast on Tai Chi and pain. It's a really fascinating subject. And again, OTs are a really good fit for it. And we hope that people feel that Tai Chi is another tool in the toolbox when you're really dealing with such a complex thing as chronic pain. So thank you so much, Carole, for taking your time out to share your insights and your expertise with us today.
Yes, thank you so much for joining us, Carole. You've been listening to the Tai Chi for Therapists podcast. If you would like to find out more about our courses or more information about Tai Chi in clinical settings, you can always head over to our website at www.taichifortherapists.com. I've been Phil.
Thank you. I've been Helen. And we'll have Carole's details in the show notes. So if you have any more questions for Carole, then you can contact her through there. So thanks again, Carole.
Thank you. Thanks for letting me talk about pain management and my passion.